Welcome to the Community Living Education Project's Sharing Possibilities and Community Connections learning event. The Rutgers Community Living Education Project, also known as CLEP, is a program through the Rutgers School of Public Health. CLEP is committed to providing individual guidance, mentoring, and education surrounding community living resources for people with intellectual and developmental disabilities. The CLEP team can serve as a bridge for advocates and families whose loved ones are ready to explore residential options outside of the family's home. We are happy you are here joining us today. Today's webinar, Poison Prevention for Individuals with Intellectual Developmental Disabilities and Their Caregivers. Today's session is being presented by Eward Green, health educator from the New Jersey Poison Center. To assure the highest sound quality possible, all attendees will be muted during today's event. We like to keep this session interactive, so ask questions using your chat or Q&A option on the bottom of your screen. And if you would like to be unmuted during this session to ask your question live, please feel free to just send us a quick message letting us know that you want to be unmuted. Topic-specific questions will be addressed as long as time allows, and for consideration to all of our attendees, we encourage you to keep your questions as general as possible. Just a note, you will be able to address questions general to the Poison Center, but any specific questions in regards to how to react to a certain incident may not be able to be approached during this session. At this time, I would like to welcome today's presenter, Mr. Eward Green. Eward, welcome.
Thank you. Thank you for having me. And I look forward to sharing information with everybody and letting the Poison Center be a resource that all can use. Again, my name is Eward Green. I'm a health educator with the New Jersey Poison Control Center. In regards to working with intellectual with developmental disabilities, I have over 10 years of experience working as a one-on-one support counselor in a group home for adults and a group home with youth, and also working with youth and behavioral. So a lot of this conversation is not only going to be, how the Poison Center can help, but more of my experience, what I've seen from, the other side of it, and, how it can be applied for those that, help the caregivers and those who provide support, be it from the medical aspect, from the personal aspect, being a senior, or even those who are helping others, without intellectual or developmental disabilities. The New Jersey Poison Center is a resource for anyone and everybody, so it's not specific just to this topic of choice, and it's a resource for anybody to use. And Melanie, if you'd like to just go over this, share information.
Absolutely, thank you. So on this slide, you will find a Community Living Education Project's contacts. Myself, again, my name is Melanie McGackin, and my supervisor, Natalie Trump. Both of our cell phone numbers are on here, as well as our most of our team's email addresses. So feel free to reach out to us at any time. And additionally, we do have the link attached. So if you want to sign up and receive future emails and information about upcoming events through the Community Living Education Project, we encourage you to go on and sign up. I will make sure that all this information is forwarded in a follow-up email that will be sent out with the recording of today's session. That should be sent out within the next 48 hours. Thanks, Eward.
You're welcome. Here's my information as well. And my information, as well as Melanie and the team, will also be available at the end of the session. So if you don't get it now, it's not a big deal. It definitely will be available for those. So I'll just give it a couple of minutes. That way, in case anybody wants to scan the QR code, be fancy, it's there. One other thing I'd like to say, that this session, I would like for it to be a conversation. And one of the things I realized while working at the New Jersey Poison Center doing community outreach is that when people do come at events, they like to share their story. I have people come by and say, hey, I had to call the Poison Center for this. The Poison Center for my kids, my husband, my spouse. So I do encourage, if you do have a story to tell, when we do have the time or even at the end, please do share your story, because it's good to hear it from other people, not just the health educator or the people from the Poison Center, because there are, a lot of stories that people do have. So now I will proceed. So the New Jersey Poison Center is a 24/7, 365 national number. There's a poison center in every state. And what happens is when you call the 800 number, you're connected to the closest poison center. If you're in New Jersey and you call, it's the poison center located in Newark and University Hospital. The New Jersey Poison Center is the only certified regional poison center in New Jersey. Again, 24/7, 365. Calls are answered by medical professionals. You have a doctor, a nurse, a pharmacist on hand who will answer those calls. They'll give you, the best the best treatment, the best answers for your questions. And if need be, or it's a severe medical emergency, please do go to the hospital and seek that help first. But this is one resource that, is to keep people from having to run to the emergency room, from having to, spend that time driving, because there are times when you don't have to go. Calls are also interpreted in over 150 languages through the chat line. Through the language line. So, we can help everybody and it is available for everybody. Also, the information is confidential. Only thing that is required demographically is generally your location. They do ask for your first name in case of a callback. And other than that, just, what was given, what was the amount, and, questions related towards the poison. So potential poisons: medication, food, recreational drugs, plants, environmental, bites and sting, household products. So what we'll do is go over some of these. I'm not going to get too in-depth, just a general overview of what these are. And then I will also tie in how it can relate to working with individuals with intellectual and developmental disabilities. So poison prevention for caregivers and individuals with IDD. One of the things I do realize, being in the field, that not everybody, with intellectual or developmental disability is going to look a certain way. From this picture, some obviously, when you worked in the field, you can tell. There's other times when you can't. As we know, the spectrum is very broad. It could go from severe case, nonverbal, behavioral, explosive disorder, pica, the list goes on and on, to somebody who's just barely on the spectrum, which is extremely high functioning and just has certain quirks and tendencies, minor stemming, and a lot of other things. So the spectrum is very broad, but that doesn't mean that, the chance of a potential poison is limited due to the disability that the person has. So medication. As we know, there's prescription, which is when you go to the doctor, they prescribe, they write out the script, and then there's over the counter. One of the things I realized when working in a group home type setting, is that the nurse or whoever is on call isn't always there. Sometimes you can't reach them. So I've had situations where, was a medication given too soon? When it's supposed to be 4 hours, is it given 2-hour window? Another common question is, which some people might not know, some medications you're allowed an hour before or an hour after. So there's questions like that, which, tend to come up in regards to medication interaction. Can it be taken with this? Can it be taken, what can it be taken with? Can I take it too soon? And somebody might not be readily available that you can't frequently contact in regards to that. So for that, you can reach out to the Poison Center. If you have medication questions, can I take it with this? The doctor prescribed this. I didn't exactly get the information. My child is already taking, what we tend to call a medication cocktail. You're taking something for seizures. To counteract the seizure, you're taking something else. For constipation, you have another medication for that. I've been in, I've had clients which have had up to 12 pills just for their morning meds, and the list goes on, liquid and, certain things like that. Or did I give enough dosage? So in regards to that, you can call the New Jersey Poison Center, ask those questions, and again, they're answered by a doctor, nurse, or pharmacist. Even something so simple as allergy medication from over the counter or cough medicine, you can ask that. There's been a situation when I was at an event, somebody came up to me and they mentioned that, they had to call the poison center because their child who has ADHD drank the whole bottle. So it's one of those things, it's better safe than sorry. So if you have questions or you have concerns or you just want to be safe, feel free to call the poison center related to medication. So this one, vitamins and herbals. So vitamins, more is not always better. Too much of a vitamin can be harmful. Vitamins containing iron, especially in young kids, can be very dangerous. It's unfortunately one of those things that because they're vitamins and they're good for you, you tend to overlook. Or you might think that, hey, it's not that serious if my child, went through a bottle of gummy vitamins. But again, for children, because of the size and the age, it can be very harmful. Herbal supplements, although not regulated by FDA, there may be a potential poison to it, or it might, might not have the right consistency or the right strain, or, might not be the right product versus the other. So due to the inconsistency, it's always good to be safe. So in regards to that, over the counter, vitamins, herbal supplements, here are some medication safety tips. Follow directions on the label, read all warning labels, keep medication in their original containers, never share or sell prescription drugs, keep medications in a safe place, get rid of unused or expired medication. And again, as a reminder, medication can be harmful if not used as directed by the wrong person or mixed with other medication. We have situations where people that keep a medication bottle or a medicine bottle because it's safe and it clicks and it locks, or they're like doubling up, putting multiple medication in a bottle to save space, or putting 3 or 4 medications in a bottle. Those things aren't safe. It's not recommended. And again, read all warning labels and read it carefully, because you'll have it where take one pill, one time a day versus take one pill, 3 times a day. So it's those little things which can lead to, a potential poisoning. So again, get in the habit, read the labels, follow the directions and take as prescribed. Food safety. So in regards to food safety, especially now with New Jersey with the no bag policy, carry separate bags. Some of the grocery stores, they have the plastic bags, separate the meats from the fruits, the fresh vegetables. Double check the sell by date and the use by date. And I know for me, working in a group home type setting, that we had to constantly go through expiration dates. We constantly had to check the sell by dates. We had to make sure that we had, the proper food safety precautions were taken care of. Because you will have kids who, have oppositional defiance disorder, where when you say, don't do this, they'll do it for attention, or they'll do it because they're seeking something. There's multiple reasons in the field why a child may just grab something and just shove it in their mouth. So it doesn't always, things as we know working in the field aren't always going to play out as planned. Anything can happen at any time, at any moment. So definitely be safe and use proper food safety habits. So the New Jersey Poison Center, we don't handle pet poisons, but people can call, and if it's something general or basic that that the doctor, nurse, or pharmacist can answer, they will answer, but the New Jersey Poison Center doesn't ideally deal with pet poisons. But if you do have a pet in the house, some of these things such as nuts, grain, raisins, salty snacks can lead to kidney failures in some pets. They can be a choking hazard, increased heart rate, excessive thirst, vomiting, diarrhea, seizures, and even death. Having a child or an individual with intellectual or developmental disabilities, they might feel that, hey, I'm eating chocolate, I want to share with the dog. I'm eating this snack, I want to give it to my cat. So it's one of those things, if something like that happens, reach out. If the New Jersey Poison Center, if we can answer it, we will do the best that we can. If not, then seek out other means and resources to deal with that. The New Jersey Poison Center also handles questions related to recreational drugs, such as alcohol and opioids. As most of us do know, alcohol consumption can be extremely dangerous in adults, teens, and pets. It can cause things from vomiting, seizures, difficulty breathing, and even death. One of the things we like to say, you should not drink to get drunk. In regards to opioids, there's oxycodone, methadone, some of the other ones. And working with IDD, we tend to get opioid type drugs, which are usually locked up, which usually have to be signed for. They're kept separate from other over-the-counter or prescription drugs due to the severe effect or the potential danger that it has. If a situation happens where, an opioid is given to, somebody that you're taking care of or somebody you service, please call the New Jersey Poison Center. At times, I know working in the field that people are hesitant because they're scared of the repercussions that might happen. They're scared that they might lose their job. They're scared that they might be fired because they gave the wrong drug. There's multiple reasons that the person that is helping and taking care of, the individual with intellectual and developmental disabilities, there's multiple reasons why they might not want to call 911 or tell their supervisor or tell somebody who's in charge. And for those people, I do say, call the New Jersey Poison Center. Call us. Let us help you. Let us be the one to answer those questions. Let us be the one to say, hey, this is what you need to do. And that doesn't mean don't call 911, but call us in conjunction with 911. And at least that way, you can, when the questions are asked or there's a follow-up, you can say, hey, I called New Jersey Poison Center when you have to do your incident report. This is the advice they gave us. This is the information they gave us. This is what we're doing to remedy this situation as soon as possible. So, in that regards, for those who work in the field, again, I can't stress it enough. And I wish I knew when I worked in the field that, we can call. It would save a lot of time of having to call 911, deal with the supervisors, deal with all the other aftermath because you kind of didn't know what to do, or you were afraid, or you were scared that, of the repercussions that might happen and losing your job. Other recreational drugs, tobacco and vaping. Cigarettes are known for causing cancer. Chewing tobacco may cause throat and mouth cancer. And there are many poison substances in cigarettes that can be deadly. Vaping contains a concentration of nicotine, such as e-liquid. The long-term effects are still unclear, and teens who use these products are more likely to begin using other tobacco products. I remember as a child, not to date myself, but they had the boxes of candy cigarettes, which, I doubt you'll find anymore. But I remember, thinking it was cool to have the box of candy cigarette and pretend you were smoking. Certain comedians would do it on stage. They had the ads where smoking was, shown as something that was cool or, hip or trendy. Now it's not so much seen that way, but you might have a child who, sees a parent or sees somebody smoking and doesn't understand, the consequences. And for those in the IDD field, there's a term called mimicking. And with mimicking, what they do is they see something and they kind of copy. So you never know when it comes to kids or just other people who's watching. And, just be conscious and mindful. And if a situation does happen where, a child or somebody you're taking care of or you're working with happens to, chew a cigarette instead of smoking it, or, break open the e-liquid or whatever it is, gets it in their skin or their eye or anything like that, please do call the New Jersey Poison Center. You can also call us for poisonous plants, things such as poison oak, ivy, and sumac. Poison ivy and oak, they, when it gets on your skin due to the oils, it can cause rashes, infections, blisters, and things like that. Most of it can be managed with over-the-counter products. Severe cases may require medical attention. Also, if you happen, you don't know when, let's say you're out and you're like throw, leaves because you're start a little bonfire or whatever it is, burning these plants and inhaling the smoke can also be problematic. I actually had a lady who, at one of the events did mention that her, young child who was special needs ended up getting poison ivy and develop a rash because, they're in the fields playing, they're running around. They're not looking out for things, the leaves of 3 let it be, which is, poison ivy, they kind of teach the kids. So, it's one of those things you never know, you might not expect it. Call the New Jersey Poison Center if, you think your child might have come in contact with a poisonous plant. Again, it's better to be safe than sorry. Reach out to us, get that information, make sure that everything is okay, and better to be safe than sorry. Wild mushrooms and berries. As you can see on the right, I know the red one, we tend to see those a lot. I think they're yew berries. The dark ones are nightshade, and with the mushrooms, those are poisonous mushrooms. For a child or even adult or anybody who isn't a professional forager or deals with those things, you might not be able to tell the difference between a poisonous mushroom or a regular mushroom. Your child can go in the backyard and think they're picking regular mushrooms because it's what they've seen in the store or they've seen in the refrigerator and eat it. So with that, again, New Jersey Poison Center, reach out to us and we'll answer those questions. If that happens and the child has the mushroom in their hand or their mouth and they spit it out, keep that. So when you do call, you'll be able to say, hey, the mushroom looks like this. They put this much in their mouth. It has these characteristics. This happened or that happened. So don't automatically discard whatever they have in their mouth, or whatever they happen to eat, or any of the products. Like, hold on to it so you'll be able to answer those questions and have some sort of identifying characters in regards to that. Again, there's no easy way to tell the difference between a poisonous mushroom from a mushroom that can be eaten. Also, poisonous mushrooms can grow side by side with the mushroom that is edible. So this one is a little interactive session that I like to do with everyone. So other than, what's in your house, what's in your surrounding, can you see anything different? I'm gonna give you a minute, just, look around and, tell me, can you see anything different? Now, other than probably what some of you had for breakfast or lunch, can you taste anything different, like in the air or just in your surroundings? I know some of you are probably trying to, get that taste in their mouth, but can you taste anything different? Now, the next question is, other than what you're already smelling, do you smell anything different in your surrounding? And lastly, can you hear it? Do you hear anything different other than what you've been hearing from your normal surroundings? I know some people are trying really hard to look for things and, see if they taste anything different, smell it or hear it. So with this one, I'm gonna give everybody a second to kind of put their responses in the chat. And I see one person said perfume. So can anybody guess a potential poison that you can't see, taste, smell, or hear? And if it was in the area right now, you wouldn't know. So for those that said carbon monoxide, you're right. So carbon monoxide is one of those things that you can't see, can't taste, can't smell, but it can be heard. And that's with having a carbon monoxide detector. Have your carbon monoxide detector checked, your smoke alarms checked, make sure the batteries in it are working, push the button, all that other stuff. One thing I do recommend is if you have a child or adult with special needs, some of them tend to be sensitive to hearing, so practice fire drills, practice, set off your smoke alarm or your carbon monoxide detector and see how your child or the person you're working with, the person you're taking care of, see how they react to it. Because you might have a situation where some kids, the fire alarm goes off and they just don't react at all. You might have some kids who the fire alarm goes off and they start panicking and running all over the place. So, practice those drills. Do it every now and then. I think it's supposed to be monthly or every couple of months, but, practice those things with the people you work with. I know for group home, it's required. And a lot of state, licensing laws do require it. But for places where it's not required, get in the habit. Know your clientele, or when you have new staff come on board, have them do it so they could see how the individual that they're helping, how they react. That way they can set up a system and, have a routine to deal with just to make the situation easier in case anything happens. So sources of carbon monoxide. You have a water heater, portable, gas generator, fireplace. You have a gas dryer, gas stove, furnace, and the exhaust from a car. Most of us do know that these things give it off, and it could be one of those things where your stove might have there might be a hole somewhere, like in the connection, or something could be loose, where the CO is leaking out. So, it's one of those things. Have your carbon monoxide, have it checked, make sure that it's working, check your surroundings and make sure that you're safe. It's better to be safe than sorry. So for symptoms of carbon monoxide, there's chest pain, upset stomach, vomiting, dizziness. Oh, I have chest pain twice. Ignore that. Confusion, and then potentially death. So if you see these things, do be mindful. And one other thing to be, conscious of is that you might be working with somebody who is nonverbal or semi-verbal, or uses sign language, or just an individual who has trouble expressing their feelings, expressing, sadness or happiness or stomach, upset stomach or vomiting. So for those individuals, again, build that rapport, ask those questions, maybe find a method where you could kind of be mindful of the symptoms. Try not to overlook it, well, they usually have, upset stomach due to medication or something they eat, or they tend to have dizziness as something that's common. Keep this somewhere, have it on your board, somewhere in the office, but look for those symptoms, because you don't want to mistake carbon monoxide for, a regular illness that might be having, or a situation again where somebody can't express how they're feeling and they're not able to tell you that I have a headache, dizziness, chest pain, and all that other stuff. So that's one of the other benefits to make sure your carbon monoxide works. It'll kind of help troubleshoot certain situations. So lead. Unlike, back in the days, if you look at that picture in the top right, when lead paint chips used to be in houses and it was common. And I recall, as a child where I'd kind of like pick the paint chips because they were kind of cool. I'd pick them off the wall and kind of break them up. A lot of houses now, built after 1978 are less likely to have lead-based paint in it. And the paints nowadays tend to be lead-free, but that doesn't mean that everybody is abiding by regulations. So, make sure, double check, that the paint is safe, that there's not, old lead in the house if you're buying an old house or remodeling or doing anything like that. Again, lead is a highly toxic metal that can cause brain damage or other serious health effects. It's one of those things where if you're in an older house and your, young one or the adult you're with has pica, where they tend to just put things in their mouth. They could sit up there and pick it and eat it, and it could be lead paint chips or anything like that. For lead in the water, you can order lead, water testing kits for lead. You can order those online and, have your lead tested. Don't wait until there's a water main break or, there's some severe reason or some disaster where they're saying, the lead in your water is at a high level, because do understand that once it gets to a certain point, then you're notified. But again, don't wait. Have your water tested regularly just to keep yourself and your family safe. So the New Jersey Poison Center, we do take calls for bites and stings. You can call us if your child, stung by a bee. They could have anaphylactic shock, allergic reaction to it. So, if you do know that you're working with someone who uses an EpiPen, which is the pen that they use for anaphylactic shock, if they have an EpiPen, keep it on them. Keep it on you. Have them carry the EpiPen around because you never know, when you might need it for bites and stings or even for, medication. Beware of ticks. I had a lady recently come tell me that, her child actually was running through the fields and she didn't realize that they were bit by a tick until after they had Lyme disease. So just be mindful when your child is out or the adult, that you're servicing, or, whoever you're helping when they come in, if they're like rubbing, at their skin or picking at a certain area or, they just look like they're in aches, joint pain, headache, fever, chills, or tiredness. Look for signs that aren't their usual, tiredness or usual level of, joint pain or dizziness or, any of those things. If it's something where normally, if the person I'm with comes in and they lay down for an hour, then they're up and they go about their business, that's fine. But if they're laying there for like 2 hours and that's not normal, or, they're holding their head and it's not something that is common, again, look for signs, look for symptoms, take notes, write it down. It's one of those things, better safe than sorry. One of the things they told me while working in the field, if it wasn't documented, it didn't happen. So I know some of you might have heard that term, but definitely document, keep records, write things down, take notes. So snake bites. Snake bites can happen. There's garden snakes. There's a variety of other snakes. You might not, snakes might not be common or something that is, you see in your area, but you never know. Somebody could have a pet snake. Somebody could have had a snake that, escaped. So call us if there's a snake bite. Again, look for identifiers, take pictures, but you can definitely call the New Jersey Poison Center for that. And again, don't wait. The top picture is from, the movie Anaconda. For those who have seen it, it probably looks familiar. And the bottom picture is actually somebody's finger who was bitten by a snake. So be safe. Again, call the Poison Center. You can call us for anything pretty much. We're here. That's what it's for. So household products. This one, when I was putting this slide together, one of the things that crossed my mind and one of the things that stood out to me was I didn't realize that I noticed household products based on their shape. So if you look at the lower, the products at the bottom, that you can kind of tell what it is based on the shape of it. If I ask, what does a bottle of Clorox looks like? You'll probably say it's white with a handle. What does a dish detergent looks like? It has a little spout and is usually shaped a certain way. But what happens when you take those products and you put them in a different container, or you're doing something where you're transferring it because it's easier to carry, it's easier to use because it's in a smaller container. So with household products, be safe. Don't transfer them to other containers. I believe I have a slide which will say that. So for this one, this is another interactive project, interactive slide that we're going to do. So we have 5 cups. So which one or which ones do you think are poisonous? You can say all 5, drop it in the chat, 1 and 2, 3 and 4, whatever it is. So I'll give everybody a second. It's funny, I see a lot of people saying all 5. If it was all 5, it'd be too easy. That doesn't mean that's wrong, though. So, kind of as I mentioned, do any of you feel that the shape of the container actually makes a difference in recognition? Give everybody another couple of minutes. Okay. Okay. So 3 and 5 are definite poisons. 2 and 4 are not a poison. And 1 is a potential poison, depending on how much is ingested and, who's drinking it. So for kids, and those who work in the field, I remember doing a morning routine with, one of the guys I worked with. And again, morning hygiene, brush your teeth, use mouthwash, and you kind of, do the hand over hand and you give them independent. But you'd have, we tend to say clients or consumers, the terminology is different depending on where you work. But I've had clients who would sit up there and, you say spit it out and they would do the reverse and swallow, or some of them like the taste of it because, the mouthwash tastes good. So if you have a young one or anybody who's sitting up there drinking, mouthwash and you're not sure, definitely reach out to the Poison Center. And again, this is just to show how many items there are, which poisonous, non-poisonous tend to look the same. I would kind of cheat and like if something was in a bottle and I wasn't sure because the label were on, I'd shake it. Because of the chemicals, they tend to kind of foam up a little bit. But, it's be safe, and just be mindful. So here's the safety tips. Oh, sorry, go back. So keep all cleaning products in a secure location where children and pets can't get to them. Place the spray nozzle in an off position when using. I know it tends to be kind of harder when it has like a long spout nozzle. You kind of have to push it down and turn it. And, keep our products in the original container and keep it labeled. I had a lady at an event, she came up to me and she was like, she had did a presentation and she had bleach in one of, the clear water bottles that you get from the store. And she had placed it on her counter and her husband came in not knowing that it was bleach and, drank it. She had to call the poison center for that. I myself have, gone to go do laundry or things like that. And I've moved things and have put it in smaller containers just because it's easier to carry, and we tend to forget to label it, because you figure I'm just gonna use it really quick and discard it. But label it, try and keep it in an original container if you can, or have a designated container. If it's in the shelf in the, in the closet or a location where it can't be locked, place it higher up. Because not everybody can afford to, has a space or capacity to lock up their stuff. So place it at a higher location. One of the other things, from when I was younger, which I always thought addition was great until you start mixing cleaning products, bleach and ammonia. So I found out at a young age that, the more cleaning products you add, isn't always a good thing. So I would take bleach, ammonia, whatever it is, figure, I was concocting something to make the ultimate cleaning product, and found out what mustard gas was at a young age. So, be mindful, even if it doesn't say bleach on it or ammonia on it, that the products may have bleach or ammonia in the content, and mixing that can be harmful. Store any leftover chemicals in the original container and never transfer chemicals to unmarked or poorly marked container. This is the last slide. And again, the New Jersey Poison Center is a 24/7, 365. You can call us anytime for anything medical related regarding, the topics that we covered. Again, it's answered by a doctor, nurse, or pharmacist. And, calls are answered in 150 different languages, and it's emergency support. We are there as another resource, so you don't have to run out to 911. Use us, keep your family, keep those that you, help say, those that you help and those that you're with, keep them safe. Keep yourself safe. And, I know I kind of rambled through the whole thing and everything else, but, if anybody does have a story that they'd like to share, we'd be glad to unmute you and, share a story. Or if you ever had to call the poison center, please, Melanie would be glad to unmute you and share that story, because it's just good to hear it from somebody else that, hey, I had to call for this reason, or I had to call for that reason.
Thank you so much, Eward. So we do have a few questions coming in. And again, as Eward said, please just use the Q&A section or the chat section and let us know if you want to share an experience that may be helpful to the other attendees today, or just to share your experience. So Eward can possibly share in another one of his presentations. That's always helpful. So just let us know if you want to be unmuted, or feel free to type in that experience through the chat section. Eward, can you talk a little bit, if someone wants to know about expired medications, and how long an expired medication can actually be used for, right? Whether that's a week, a month, a year after the date posted on the package, where would they go for that information?
So again, in regards to expired medication, you'd call the 800 number and you would ask, and, look on the box, but what happens is we tend to throw things away, the containers and the packaging and stuff like that. But for expired medication, you call the poison center. Same thing with expired food or use by date, call the poison center, because each one is different. So I'm not equipped to answer that question, but do call. And I know a lot of medication, they do have numbers and identifying information on it. So use that. And if you're not sure, the best thing to do is discard it and buy new one. And when it comes to medication, discarding medication, they do have drop-off locations, and certain townships do have brown bag events. I know I've partnered with Irvington Township, where they have a brown bag event where they collect all the old and expired medication. So there are events and drop-off locations where if it's old or it's expired, as Danielle mentioned, certain police departments do have drop boxes for expired medication. So, find what's closest to you. And it's better to do that than to flush it down the toilet, where it can get into the water system.
Can you talk a little bit about the qualifications of someone answering the phone at the Poison Center hotline?
Yeah, so the people who answer the phones, they're doctors, they're nurse, and they're pharmacists, and who specialize in toxicology. I work in the Poison Center, but I work in the health education part. But everybody there is licensed, and they're professionally trained in order to answer these questions and to help you.
Wonderful. And is there a cost associated with calling in?
There's no cost at all. It's free. And it's the 1-800-222-1222. There's no cost at all. It's free. It's 24/7, 365. Although if your pet is poisoned and you call the poison help, do understand that there is one for pets. So it's the pet poison helpline, and that one, they may charge you. That's not us. So ASPCA. That's not us. So, don't be like, hey, I called the Poison Center and you guys charge me. The ASPCA does charge for that, and that's a whole separate, pet prevention and poisoning.
Okay. Do you have a slide with your contact information on it, or the Poison Center number posted, just so everyone can see that?
So again, the Poison Center number is the 800 number, which is here. And that's Melanie's and her team's contact information for those who weren't able to, who might have come on late.
Wonderful. We actually have someone, it's actually a wonderful point that someone made, that blue dye and buttercream frosting sent someone to the emergency room with an entire body rash that the person saw shifting. This individual had to get a shot of Benadryl. So even safe foods can sometimes cause harm. It wasn't a poison, but it was a severe allergic reaction, right? So in that example, is that someone that could also call the New Jersey Poison Center?
Yes, you definitely call for that. Because you do have situations where somebody might not, know that they're allergic to something, and they find out, hey, I'm breaking out or a rash, and I have had situations where people are allergic to dye, or certain colors, and things with certain colors in it and stuff like that. So you would, call the New Jersey Poison Center, and that doesn't mean don't call 911 or don't, go out and seek additional medical attention. Like, call us and call 911, or call us on your way to the hospital. If you feel that it's that, it's that severe, or that needs to happen. Like, don't, disregard everything else and be like, well, New Jersey Poison Center said call us and they'll take care of everything. No, like, use us in addition to the other resources that are available.
Wonderful. And Danielle is also joining from your office. So if you want to just briefly introduce her, that's great.
Yes. So
Danielle, were you able to unmute, Danielle?
Oh, yes, I was. Hi, thank you.
Hi. Danielle, please feel free to introduce yourself also. I know that you've been on throughout this session, but just wanted to give you a moment for an introduction.
Yes, thank you. So my name is Danielle Barchi. I'm also a health education specialist and community outreach specialist with the New Jersey Poison Control Center as well. I've been with this center for about 6 years. I think I've presented to I don't know if it was this group or another Rutgers group, but I've presented to one of them before. Neward, you did a great job.
Wonderful job, Ewart. And then we do have a few more people asking some general questions. I saw a few more responses come in regards to the medication disposal, some suggestions around that. What I'll say is reach out, right? Call in, use one of those official Dropbox sites, or call the Poison Center to get specific ways of how to safely dispose of that specific medication, if you would. But Danielle, Ewart, someone's asking, how long is the wait for phone response from the Poison Center?
So when someone calls the Poison Control Center, the phone response is immediate. If you are put on hold and it is an emergency, we actually do even have an option. It'll say, if this is an emergent situation, press, I think it's like 9. And that will get you directly to someone. The whole time, though, there's very infrequently a whole time. We have enough specialists on to cover the lines. And like I said, if there is any kind of hold, it would just be like a couple of minutes, under 5, definitely.
Wonderful. Thank you so much. And again, we have some great responses, suggestions. The SPCA suggestion was coming through chat also. It's informations like this, right, where we have the resources of each other to share that allows our resource, database to grow. So thank you to everyone who responded and asked questions. Ewart, Danielle, do you want to provide any additional comments before we say goodbye for the day?
No, only thing, just again, and we stress it, anything can be a potential poison. If, go ahead, Danielle, you say this part so perfectly. Taken the wrong way, eaten the wrong way.
So we can, at the Poison Control Center, we consider anything when it's used in the wrong way by the wrong person or in the wrong amount. If it can hurt them, kill them, or make them sick, then it's considered a poison. So, like Ewart said, you see those bottles and you immediately think, oh, a cleaner is a potential poison. But your shampoo bottle looks very similar to a lot of those things. A kid or, someone who is just even not paying attention, you see the bottle, you grab it, you might, you don't know what it is. People get it in their eyes, they get it on their skin. It's very easy to make a mistake. And also, like Ewart said, with those mimicking behaviors, the number one poison we see in children, it's personal care products. And the reason for that is because kids see adults using it. They see the adults in their lives who are, showing them how to use things. They see them using it. So, we get a call because someone grabs the toothpaste and, gets too much of it in their mouth or things like that. So it's important just to know that just because you may not consider it a poison, you have to think, well, if too much of this is used, if it's used by the wrong person, will this become a poison? I also just wanted to mention too, the poison helpline, the 1-800-222-1222 is a national number. We have one poison control center in New Jersey. However, you can call that number anywhere in the United States and you will be connected to the local regional center, and everything Ewart said today will apply exactly the same to that center as it does in New Jersey.
Wonderful. And it's funny, Ewart, as you were mentioning the mimicking behavior before, so true. But I think also, right, we were talking about those visual presentations, right, of how we look at certain bottles and as adults, right, typically know what's in those bottles by the shapes. But I think also is talking about the scents, right? And a lot of the vapes, for example, have very sweet, attractive smells to them, some of them, right? So a lot of times it's the scents that are even pulling children or individuals who may not have the awareness of a danger to a product. So I think for us just to make sure as a community that we are keeping things locked up, safe, secured from individuals who may not have that awareness yet is really going to be key. But know that The 800 number that is on your screen is absolutely going to be a wonderful resource. If you have any questions at all, when in doubt, give them a call. You know, the New Jersey Poison Center will be able to provide the guidance that's needed to keep you healthy and safe in one of these situations. So, Eward, thank you so much. Danielle, thank you also for joining us. Thank you to everyone who participated in the chat section today. There were some great suggestions and resources coming through, some awesome examples that were being shared. So we greatly appreciate that. You will, within the next 48 hours, get a resource. I'm going to try to attach the PowerPoint slides to that resource, so everyone has a copy of the PowerPoint in a PDF format, so you can have that to reference. We're going to try to get the recording of today's session posted, and I will provide a link in that email also. If you need any additional information, supports, or services from the Poison Center, reach out to their number. And also, Eward has his QR code, the scan code, that you can quick snap a picture of since it's still on your screen, if you need to reach out for any reason. Again, as we're going to say goodbye, please look for a link that will be followed up also via email. That link's going to allow you to take a quick 30-second post evaluation. Let us know what you thought of today's session, but more importantly, please feel free to share any topic specific information that you're looking to hear about, learn about, or just need to explore for additional information. It's going to be the information that you share with us that allows us to really tailor the information that we're sharing with you for future sessions. Thank you everyone for joining us. Eward, again, thank you very much. And Danielle, thank you for providing your introduction.
Thank you, everybody.
Bye everyone, be well.